Hello, my name is Fred. I'm an FNP student. This is a focused cardiovascular exam. First, I'm going to start off by inspecting the patient's neck. I'm going to look for carotid pulsations and JVP. So I'll have her look up slightly, use tangential lighting against the neck there. Helps bring out those pulsations. I do note carotid pulsations. I don't see any obvious distension. Okay, I would ask the patient, well, I'm not going to ask the patient to remove her clothing, but if I did and when inspecting the chest or the PMI, I'd be looking for any abnormal pulsations, any heaves or lifts, abnormal heaves or lifts of the chest wall. I'm going to go ahead and palpate her carotid area, her carotid pulses. I'm just assessing for any vibrations or thrills. It's about a 2+, a good brisk tap. I don't notice any vibrations or thrills that would indicate like stenosis or turbulent blood flow. We'll go ahead and palpate for her point of maximal impulse. So I'll start over here on the left side, mid-clavicular line. Palpate down to about the 4th or 5th intercostal space, which is where it usually is located. All right, so about the 5th intercostal space, a good brisk tapping, and you don't want the PMI to be greater than 2 inches in diameter. So I'm going to go ahead and if I did have trouble palpating the PMI, I could ask the patient to lay in the left lateral decubitus position, but I'm not going to have to do that. I didn't have any trouble palpating it. We're going to go ahead and palpate for any ventricular impulse or aorta. We're going to the aortic arch. So starting here on the left side, I'm going to palpate down to her 4th or 5th intercostal space. Find that, and then palpate 3rd, 4th, and 5th interspaces simultaneously. If I noticed any abnormal pulsations here, it could be indicative of hypertrophy or left ventricular hypertrophy or enlargement. So go ahead and palpate the aortic arch, roughly 2 inches down beneath the clavicle on the right sternal border. And if I had any abnormal pulsations there, it could be suggestive of an aortic aneurysm or aortic regurgitation. I'm going to go ahead and measure her JVP. So what I'll do is I'll have her lean back to about a 30-degree angle if she can. And I'll place the ruler on the sternal angle. And what I'd like to see is a 3 to 4 centimeter measurement. So lean your head back for me there. Look over. Sternal angle. So it looks to be about 4 centimeters on the right side. Looks to be about 4 centimeters on the left side. Anything higher than that could be indicative of like fluid overload. Okay, now we're going to move to auscultation. I'm going to go ahead and auscultate the patient's carotid pulses. Listening for any bruits. I'm going to use the diaphragm of my stethoscope. All right, take a deep breath in and hold it. All right, you can breathe. Take a deep breath in and hold it. Okay, I don't hear any bruits, so that's good. I'm going to go ahead and auscultate her heart in various places, and I'll call them out as I do. So we'll go ahead and auscultate the aortic, pulmonic, Erb's point, tricuspid, mitral. We'll listen at the apex. There's a good love dove sound. I hear S1 and S2 clearly. S1's louder than S2. We're going to go ahead and switch to the bell of my stethoscope. This helps me to hear any low pitch sounds, S3 or S4, and the additional heart sounds. So I'll do the apex of her heart, and then interspaces 4 and 5. And the left sternal border. All right, I don't hear any S3 or S4. We're going to go ahead and have her lay in the left lateral decubitus position. And what this does is bring the ventricle closer to the chest wall to where I can hear those sounds a little bit more clearly if she did have any extra heart sounds, S3 or S4. I do not hear any S3 or S4. I don't hear any murmurs. So I'm going to go ahead and listen to the her diaphragm, and I'll have her lean forward. And what this does is accentuate any high-pitched sounds. So I'll listen to her apex and then the left sternal border. I'm sorry. I need to ask you to please inhale, exhale, and hold it, okay? Okay. I do not hear any high-pitched sounds. I'm going to go ahead and listen to her carotid pulse again, and to get her her rate, her beats per minute. Our heart rates are roughly about 74 beats per minute. Overall, the heart assessment is good. There's a clear S1 and S2 sound. S1 being louder than S2. I don't hear any splitting of S1 or S2, any additional S3 or S4 sounds. There's no audible clicks and no murmurs. So overall, she sounds like she has a healthy heart.